do you find that large organizations that are invested in innovation, like for example, Kaiser Permanente, are they becoming more used to that type of more progressive investment, right? So smaller blocks of, let's say, funding or buy-in to get to a certain point where, no, it may not be a complete solution, but you're going to know if you're on the right track. And then if you're on the right track, then we're going to go one step further and in kind of progressively supporting these types of internal innovations.
Yeah, I think it's interesting. At the time when I was there, I could see, I mean, yes and no. There was some evolution in that space. There actually was some backtracking depending. It's such a big organization, and there's so many different verticals within that organization. It was very complex, and there began to. It started with that mantra, and then there was like internal innovation grant funding, and then it kind of migrated to a phase of like, well, let's work with the big companies. Let's work with like Microsoft and the Googles and the and the big mega companies instead of the small early startups, because it's, you get things that are maybe baked, you're spending money on these things, and then you may not get a result. And I think some healthcare organizations aren't necessarily ready to take that on, right? So now, has that changed in the year and a half since I left? It may be migrating a little bit. And you can look at the development of Graphite Health, which Kaiser Permanente is participating in, which is kind of like an app store, or kind of like a collection of different innovative tools. And there, I think Intermountain Health has joined, and some other groups, but they're trying to look at that market mentality of, hey, let's see what other smaller companies out there are doing. So I think it varies. It goes up and down, and it depends on which particular, in a big company like KP, it depends on which particular vertical you're talking to. And I try to tell, like, when I'm kind of doing informal or formal advising, or just talking to other people, I'm like, Kaiser, you want to come to a big company like Kaiser with ideas that are definitely, beyond your pre-seed or your seed stage. You want to get something a little bit, maybe into Series A. You want to get product, you want to get things working. You maybe want to have gone through an accelerator or an incubator first to really make sure you have a little bit of credibility. You've kind of tested some of your products. And you can find, in big corporations, you can find people that are willing, have a little bit more tolerance for ambiguity and tolerance for risk, and may be able to take you on. And different even payers now are doing that. Like, there's stuff coming out of Humana and, other groups. Cigna is developing and or acquiring different types of companies that are willing to take some risk. And that's, these new innovative companies are kind of part of that. And I think just for healthcare to scale up, it's going to have to take a little bit more risk, or put out some of its budget for R&D, or be willing to try new things. The pandemic has just kind of accelerated, what has been obvious to someone like me for years, and a lot of us, is that virtual care is going to have to expand to, surpass some of the social determinants of health, or some of the access issues, that are just, plaguing healthcare. And we're going to just have to get better, and technology is not the only solution, but it's something that can augment people to expand their capabilities.